Good morning. How is everybody this morning? So, I've tried to make this video a few times this week, and it seems like there's been something that's gotten in my way every single time. So, we're gonna try this again today. Hopefully, I'll be able to post this at some point. Anywho, with all that being said, I am absolutely tickled. I got a four whole views. I'm not trying to be facetious. I'm not trying to be funny. I am genuinely tickled that I got 4 whole views on my last video about return on investment with regards to our taxes. Um, Generally speaking, our federal taxes, but in some cases, local and state as well. And I got the 4 views, and I could not be more thrilled. And I got some likes, and I even got some comments. I got some interaction on the video. So if any of those same people are watching this video today, thank you for doing that. That y'all made my day. Even if I didn't agree with you, even if I saw your comments, which I did comment on somebody who I didn't exactly agree with in most cases, and I thought that maybe they didn't fully understand the video. They were talking about how the rich really do pay their fair share and whatever, and I wasn't trying to discuss, how much people are paying on their taxes, but simply, do we feel like we're getting our money's worth? But I appreciated the comment. They actually went into some detail and went into statistics, and I commented on their post kind of with my rebuttals and where I agreed with them, where I didn't agree with them, and as of right now, fairly civil discussion. With that, I do want to, anybody else who is watching this video today, if you're one of the 4 people who liked my video before, please like this one as well. Please, again, comment below, even if it's just, hey, watched your video, thank you for posting, whatever it happens to be. Even if it's rude at this point, like, I don't really appreciate those, but interaction is interaction, and I'll take what I can get. But yeah, thank you for all of that. As always, as you hear from every other creator on any platform, hit the like, hit the subscribe, and notification bell too, if you want to notice when you want the notification whenever a new video goes up. I'm trying to get to where I can post at least once a week, so hence why I've tried to make this video so many times. Anywho, let me go ahead and get into I guess would be part 2 of my last video. I don't know how many parts there's going to be, but definitely some related content here. So, like I said last time, and like I said earlier, just a few seconds ago, I'm trying to get to the bottom of if people feel like they're really getting their money's worth on taxes. And I think the conversation around taxes isn't we need to pay less, but we need to get more for what we pay. I know nobody likes to pay taxes, but I think it would be far less painful if we felt like we were getting something for our money. Yes, we absolutely, with regards to like federal taxes, we absolutely have, the military funding. I'm sorry, I refuse to call it the Department of War, because that's not appropriate. And unless you're, for somebody who's out there saying that, I'm trying to end all the wars and blah, 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 we shouldn't be calling our military the Department of War. So I will still refer it as Department of Defense. Now, I am not a military personnel. However, I am the spouse of a veteran. I was the spouse when he was in of a active duty service member. So my whole family was military, or at least former military. My father was a veteran. My grandfathers were veterans by the time I came along. Anywho, we absolutely have those tax dollars going to the military, the Department of Defense, and I think there could be definitely some checks and balances there that don't seem to be working, or they're there but they don't seem to be working anymore with regards to how much they're spending and what they're spending their funds on. That's definitely a benefit of our tax dollars. But it's intangible, right? Like, it's not something that we necessarily can see in our day to day. I think it's more something that we need to be seeing in our day to day. And are there people who are benefiting from federal programs like SNAP and Medicaid? While state run, it is federally funded. At least in part. Medicare is another one that's federally funded. Disability benefits are federally funded. For those individuals, they're absolutely feeling that. But for those of us who aren't receiving any of those benefits, it can absolutely feel like, well, why do I need to pay this money? Why, all of this money is just going towards these things that other people are benefiting from that I'm not. And that's kind of what I feel, where I feel like the disconnect and the problem is we're not, every single American isn't feeling that they're getting a value for their dollar. And that's kind of why I kind of want to have these discussions. So foremost on my mind, as somebody who has recently been diagnosed with the big C, and has, sorry, I have cats at home, and I feel like I have a cat hair in my Carmex on my face. Anywho, so with regards to healthcare, especially since every so often you'll see, that Luigi Mangione is coming back into the news. For those of you who don't know, Luigi Mangione is accused of unaliving a CEO, I believe, of a major health insurance company, because this is all my interpretation of things, so not any kind of legalese. I am just a layperson. This is just how I understand it. He believes that these individuals are evil and making life and death decisions about people that they should be leaving up to the medical experts, and that they're in essence just unaliving hundreds, if not thousands, of Americans on the daily because of the profit-based decisions that they're making. Now, with all of that kind of in consideration, it really is kind of mind-boggling how we have monetized healthcare in this country. We're currently, I believe, the only first world country that has monetized healthcare. Obviously, please, if you know something more than I do, by all means, let me know. But I believe that's my understanding of how things are. I'm always up to be corrected. If, like I said, if you know more information, you have more information than I do, by all means, please let me know. I don't think that your ability to, your access to money should control your access to healthcare. I think that as just humans, we need to take care of one another, and that everybody should have the same right to life, right to health that everybody else has. Maybe that's a radical idea, but I think that anybody who values human life should absolutely have this opinion. And I think that our current model here in the US, as most of us get our health care through our employers. Yes, I know that's not standard across the board. That's why I said most. Most people who have health insurance have it through their employers. Now, there's some things to consider here. When you get your health care through your employer, it's been my experience that Very rarely do you have the option of, with regards to health insurance, you have the option of picking your insurer, your insurance company. You may have the choice within an insurance company, the choice of plans. So, for example, if you have Blue Cross Blue Shield or United Healthcare, you may be able to pick, say, a high deductible plan versus something that, there's no deductibles, but there's co-pays. Whereas, like with maybe like a high deductible plan, you may have something that has no co-pays once the deductible is met. Just as an example. And one may be cheaper than the other, one may fit your needs better than the other. So you get to choose. And with smaller companies, you may not even get that option. And you may just be stuck with whatever plan they offer. I bring this up because one of the arguments that I hear most often against a national healthcare system, right? A national healthcare program, whatever you want to call it, is that there's going to be lack of choice. Now, I don't know what y'all's experience has been with medicine, insurance companies, what have you, but I've never really had a whole lot of choice. I may have the choice in the plans. I think maybe once I was given a choice of providers, but there was no choice of plans. Like you had this plan provided by this provider or this plan provided by this provider, and those were the only options that I had. And with most other situations that I've been in, it's here's one insurance provider, here's one insurance company, here are the plans they offer. You can choose the plan that fits your needs and fits your budget. And then speaking about choice, once I have chosen my insurance provider, then the illusion of choice would be the actual healthcare provider that I have. So the doctors, the facilities, so on and so forth. Now, I say illusion of choice here because a lot of times we've all seen it, right? If you have health insurance, you've seen this. You have your in-network providers and your out-of-network providers. Now, your in-network providers have a deal with the insurance company that they're going to allow the insurance company to pay a set rate based on the contract that they came up with, and be it for the service, the medication, the hospital, the doctor, what have you, but those things are in network. And anything outside of network, they either don't pay for or they pay significantly less for because they don't have a contract with those individuals, those businesses, those hospitals, what have you. And that gives you the illusion of choice, right? You don't really have a choice. You still have to go with whatever providers are in your area that have signed those contracts if you want the least amount out of pocket. And I don't know about y'all, but things are expensive right now, so I'm absolutely going to go with the in-network option. I will avoid the out-of-network options at all costs. And I believe that this is for a couple options. One, out-of-network cost saves the insurance companies some money because they don't have to pay as much for those providers. And two, it probably forces those out-of-network providers to play ball and sign those contracts. And it's that in and of itself feels dirty and wrong. Like, I don't like it. But again, opinion. So it is what it is. Back to why this is important with regards to a national healthcare system. I do think that private healthcare still needs to be a thing. It still needs to be an option because there's going to be people who want care, can pay for care outside of a national healthcare program. Plus, it will take time. outside of just tax dollars, it will take time to set up the infrastructure for that. I don't think, I don't like contractors for government work. I think that allows for corruption. It allows for a lot of the things that we're seeing anyway right now as it is. Now there are certain things I think that should be contracted out. Like if you're, building your construction and you're building a new federal building or you're remodeling a federal building, yeah, by all means, like we don't need a government force construction crew. I don't think bid lowest contract gets the bid. Like I get all that. However, if we're going to establish a national healthcare system, like we need to have federally funded providers, right? We need federally funded hospitals, federally funded doctors. We need people to sign up for these programs to be on the providing end of things. The pharmaceutical companies, that would be something I guess would have to be contracted out, or the deals need to be made with these pharmaceutical companies to develop the necessary medications and medical devices that patients need. And I think that could probably be handled as it is right now, but that's where dealing with them, especially on a national level, the weight of how many people would be on that program, given it's available to every American citizen, regardless of income level. Like right now, programs like Medicare, I think, and Medicaid, I know Medicaid is income based, but Medicare, I'm not quite sure. I think that's just age based. I don't know, so correct me if I'm wrong there. But all of those are need-based programs, and I think that if we're going to have a robust healthcare system in the nation, it has to be across the board, regardless of income level. And this, I think, would benefit Americans in several ways. One, you have the option. Do you want to pay out of pocket for a private provider? I don't even think the insurance companies necessarily need to go away. I think if you want to pay for a private insurance that's going to give you access to private health care, by all means, I think that should be an option for you. But I think that all American citizens should be offered a national health care system where if you need care, you've got it. Your tax dollars already pay for it. Maybe you pay a couple of dollars here or there for incidentals or things, maybe like a prescription or what have you, that could not have been mitigated beyond a certain price point. The government pays X dollars, you pay above that, kind of like what your insurance does with a copay. I think that's reasonable. And I think all of us would, because you have more people, like you do with your employer, the more people that sign up for your healthcare coverage through your employer, the cheaper your premiums are, especially if you have even more healthy people on those programs. I think if we had a national healthcare plan, that would cause take our premiums, we wouldn't be paying those anymore. And now we're paying maybe a couple of dollars more per person on our taxes. But it's still going to ultimately be less than what we would have coming out of our paycheck between taxes and insurance premiums altogether. So I think that would be a net gain for American citizens. I think not having to pay as much out of pocket as far as premiums are concerned is a gain. By the time you add in all your costs, your premiums, your deductibles, your co-pays, all of that, plus any incidental coverages, things that aren't covered by your insurance company that would be possibly under a national healthcare plan, then it's going to ultimately be a net money saver for American citizens, not to mention for employers. Now employers don't have to rely on, well, we have to pay part of the premiums through the insurance company for our employees to have coverage. This is something that would open up small business windows, because a lot of us that would love to open our own business. Lots of us don't, specifically for healthcare needs. We need that insurance through our employer, and we can't seem to get it any other way. So, and if these people don't stop parking in my parking spot, my goodness, so annoying. And not even parking straight in the parking lots. It's even worse. I think that could ultimately end up being something that saves a bunch of Americans a great deal of money. I think we'd have a spike in entrepreneurship, and I'm all about that. I think it would create jobs in this country. This is also going to tie into yet another video that I'd like to talk about, which, again, getting more bang for your tax dollar buck. We'd feel the benefit from this too, by the way. It would be something that would be tangible. It'd be something that we would be using on a regular basis. This healthcare system, it tons of jobs. And I think this also ties back into the next video that I plan on making, which is education. I know a lot of people balk at having education paid for with our tax dollars, but I'm gonna put up my case for that, and it's probably gonna have some opinions that a lot of people are going to be like, whoa. But I'm going to be bringing up things that I've heard, not necessarily my opinions, but things that I've heard from other people. So look for that one. In the meantime, thank you for watching today. This is definitely something that I think is a huge discussion that needs to be had, and I don't have enough time in the short drive that I have to work in the morning to cover every nuance to this that I'd want. But thank you for watching all the way to the end. Again, hit the like, hit the subscribe, add some comments. Let's start this discussion. Let's keep the discussion going. Let's see if we can't get more bang for our tax dollar bucks. And I will see you on the next one. Thank you.